Circle series. These important discussions would not be possible without their support. So a huge thank you to Advocate Aurora Health, AARP Wisconsin, Anthem Blue Cross and Blue Shield of Wisconsin, Gunderson Health System, Hush Blackwell, and WPS Health Insurance. Wisconsin Health News is an online, nonpartisan news service. In addition to hosting events like these, we also publish a daily email newsletter. If you are not yet a subscriber, I encourage you to sign up for a free trial, which you can do at our website at wisconsinhealthnews.com. And an extra thanks today to WPS Health Insurance, today's featured sponsor. We are very grateful for all of their very generous continued support. Here to say a few words is Deanne Bagley, Vice President of Communications for WPS.
Yes, thank you and welcome everyone. As most of you know, WPS stands for WPS is part of the Wisconsin Physicians Service Corporation. So WPS Health Solutions is the name we go by today. We were founded by Wisconsin physicians to care for soldiers returning home from World War II. Just a wonderful history. We just celebrated our 75th anniversary last year, and we really keep this tradition alive today in our claims processing and management of the TRICARE program for the Department of Defense. So we administer health benefits for all military service members throughout the world who are active duty and retired. So a very big responsibility for WPS. We're very proud of our military service. Earlier this month, WPS Health Insurance actually announced its market launch of insurance into 4 new states for Arkansas, South Dakota, West Virginia, and Nevada. These new states are now able to enjoy WPS's wildly popular Medicare supplement coverage. And that's just the start. We have many more new states on the horizon going to a national footprint. So we're pretty excited about that. At WPS, our goal is to make healthcare easier for the people we serve, and we're hoping to serve many more in the years ahead. Today's topic is an important one. At WPS, we are undertaking a new mental health initiative to drive rapid change in access to care. And substance use is often associated with mental health issues. And so we look forward to the discussion today and to see where we can help with our customers and service providers alike. So thank you for joining us today, and it's been a privilege to sponsor.
Well, thank you, Deanne, and thanks again to WPS for all of the really generous and continued support. Thanks again to our esteemed panelists for sharing some of their valuable time today to talk about this important topic. Alcohol-induced deaths rose nearly 25% in Wisconsin in 2020 following the national trend amid the stress and isolation of the COVID-19 pandemic. It was the largest year-to-year increase in decades in a state where excessive drinking rates are already among the highest in the nation. Yet efforts to curb use often fly under the radar. So we've rounded up an expert panel today to discuss the significant health and economic toll that alcohol takes on the state and outline some of the efforts to address this health issue. And Maureen, let's start with you. Just how serious of a health issue is excessive drinking in Wisconsin? And just how high are the drinking rates here?
Every county in our state exceeds the national average for excessive alcohol use. So that is extremely significant. We're the only state like that in the nation. And excessive alcohol use is binge drinking, which is 4 to 5 drinks over a couple of hours, because that's when you would hit your blood alcohol content of being intoxicated, 0.08. Underage drinking, drinking while pregnant, and heavy drinking, which is 1 to 2 drinks every day. So that is very significant that, you know, we have counties that are around 31% of the population that are using alcohol excessively. I did want to say a couple other just pieces. This does not represent the Medical College of Wisconsin's policy positions. I'm speaking as an expert in alcohol policy and how to reduce excessive alcohol use. And I also just wanted to acknowledge I have a black eye because I fell down some stairs during COVID. So just if you were looking and wondering, just to put that out of the way. And I'm here today at the KI Center in Green Bay, since we have the alcohol policy seminar tomorrow. And we're super excited to bring together experts from around the state to talk about this issue.
Great. Well, thank you, Maureen. So are these rates, Maureen, are these rates getting better? Are they getting worse? And has COVID-19 had an impact on these rates here in Wisconsin?
Yes, COVID-19 has had a major impact on rates. We started seeing significantly higher death rates starting in June of 2020. So we went up, as you said, 25% from 2019 to 2020, and we have continued, unfortunately, to dramatically increase. Not the 25%, but year over year, we keep that, we've been rocketing up for a long time, and it hasn't slowed down, which is really obviously unfortunate. We had hoped maybe this would be temporary, but it doesn't appear that way at this point in time. But not everybody drank more during COVID. So I do want to be clear about that. We had about a third of the people. So first of all, we have about 68% of the population that drink alcohol. So the other part of the population doesn't. So I'm not going to talk about that part. I'm going to talk about the people who are drinking. So about a third of the people drank the same during COVID. A third actually drank less. And then a third drank significantly more. And now we're seeing on the national level, like extremely high binge drinking. That didn't used to be a definition, but now not only do we have binge drinking, but we have really high levels of binge drinking. And when Wisconsin, we've seen between 7 and 9 drinks in a binge, which is again, extremely high.
And then you, thank you, Maureen. John, at Impact, you hear from thousands of Milwaukee residents each year seeking help. About what percentage, roughly of those are related to alcohol, and are you seeing any impact from COVID-19 as well?
Yeah, so in our role in the community, and some of you know us, we deliver part of the state's 211 system here in southeastern Wisconsin. And we've got a couple of other programs where we work with Milwaukee County to screen and assess and connect people who are seeking treatment to services. And of about 7,500 contacts, about half of those were alcohol related. And that's a bit of an increase, but I'm also famous for saying in Wisconsin, alcohol is king. So amid all of the other tragedy around fentanyl and heroin and opiates, which tend to catch the headline, alcohol is, it's sort of the slow, silent, painful, leaves a path of tragedy behind it. And it's just part of this drinking culture that we have. Maureen was talking about that we exceed national level on every single county, and I'm not surprised to hear that. You've heard the expression rose-colored glasses, and I say in Wisconsin we have this beer-colored glass that we have, or glasses that we wear, where we don't even realize how much we drink. It's just become such a part of our everyday life that people are drinking in a way. And you talk about extreme binging, and I bet you people don't even necessarily think of it as extreme. They think of it as Friday or Saturday night, or what I do at a Brewer game or at a Packer viewing. And so Wisconsin has, I used to use this true or false question, that Wisconsin has 5 of the top 10 cities and bars per capita of all cities in the US. And the answer was false, because the number is actually 7 of the top 10. So, and then you take that level of alcohol consumption and then combine it or layer it with the pandemic. And I'm not surprised that at least in one category, you said, Maureen, some people are drinking more. That doesn't surprise me. People had access to it working remotely and working at home, made it easier in some ways. And although I'm encouraged to hear you say, Maureen, that wasn't everybody, right? That there were some people that, as a matter of fact, drank even less, which is, I think, not a part of the story that I've heard. So I'm encouraged to hear that.
Thank you, John. Dr. Hartlaub, at Ascension, you've implemented a screening tool to help identify excessive drinking amongst patients. And I want to get into the details of that model a little later in the program. But first, can you just talk a little bit about what you've seen so far from these screens? I mean, about, how many of the patients that you're seeing with this screening model are being identified as having alcohol overuse issues?
Sure. So we started this screening program about 2 years ago. And the reason we started it, there's a couple different ones, but hospitals are required to do community surveys to see what's on the mind of the communities. What are their priorities? And what rose to the top across the state for us in these surveys is alcohol and drug misuse. So it's on the minds of people. And also it has been shown with good evidence that screening for unhealthy alcohol use and providing some brief education, brief intervention really makes a difference for people, because they just haven't been aware that the amount they're drinking is potentially harmful. So once they learn that, it really makes a difference. It's an effective thing to do within the healthcare system. So that's kind of why we started it. And so over 2 years, we introduced it about 2 years ago, and it just, the rate of screening has continually increased within our system from about 20% is where we started. 20% of adults were getting screened up to where it is currently, which is over 75%. So we know that statistically in general, about 20% of those will have an unhealthy level of alcohol use. It's higher now, probably over the last year or two, as Maureen was saying. We initially looked at the percentage of referrals. So people who were in a category of drinking that really required a more extensive intervention or help. And the number who got the education for a less but still unhealthy level of drinking. And those numbers were fitting what the general statistics were. So about 20% were unhealthy, and then about 5%, 4 or 5% were at a level where they required an even greater intervention, more than just some education, more like a referral or more extensive help.
Great. And these are patients that previously had not, a lot of them had not been identified with. That's
correct. Yeah, that's correct. Yeah. Most of them had not been. Prior to doing the screening program, we were just asking if they drank alcohol. Mm-hmm. And basically or two, and then nobody was doing anything with it. Well, I can't say nobody, but I mean, in general, we weren't doing much with that information. But now we have a prescribed course that we do in terms of some education.
Mm-hmm. Thank you. Jerry, how prevalent of an issue is this among the state's municipalities? How busy are local law enforcement, would you say, in responding to alcohol issues?
I put that question, and let me say at the outset, unlike my esteemed panelists, I'm not.
You're going to sell yourself short, Jerry, but we're not going to agree with that.
I'm not going to throw a lot of statistics at you, but anecdotally, I put that question to one of my mayors, and what his police chief told him, he said, what percentage of arrests and calls relate to alcohol? And the police chief looked at him and said, well, after 10 o'clock, all of them. And 10 and 2 is the busy time for most police forces. It is the driving force. In Madison at the homeless shelter, someone that I know does intake counseling for homeless people. And well over 80%, probably nearly all of them, are exhibiting active, they're drunk. I mean, they walk in there, stumble in there, whatever. Alcohol is a major factor there. There's another side to this too, Tim. If you talk to a defense attorney, there's a cottage industry of people that defend drunk drivers. And the very first thing they do is they go through the arrest with a fine-tooth comb. As a result of that, it's not enough for a police officer to simply say, oh, you're weaving, Tim, I smell alcohol on your breath, away you go. it has become a highly complex, very detailed arrest. The chemistry work that goes behind it, and all of that is cost. All of that is cost. So I don't have numbers to give you, but I will tell you it is the biggest cost driver for law enforcement. And when it comes to paramedic and EMS, it's probably only number 2 to aging because of the nature of our population these days. But it's a growing problem.
And I think the bottom line is, hearing from all of you is that this is a really big issue in Wisconsin, impacting a lot of people. I mean, I think it's probably safe to say that most people in the state have been impacted personally by alcohol abuse. Maybe it's something they suffer with themselves, or they certainly know someone who has. Dr. Hartlaub, what are the health impacts of all this over drinking? I mean, we talked at the beginning of the program about the growing number of Wisconsinites who are dying, but how else is alcohol significantly impacting the health of a lot of Wisconsinites who don't die? I mean, can you talk more about these health impacts of over drinking?
Sure. And I think it's probably easiest to think of it in 2 general categories. One is immediate health effects from an unhealthy level or risky level of drinking. And then the second is long-term impacts. So the immediate impacts include some of the things we've been talking about. So injuries, motor vehicle injuries. There's a lot of violence. There's an increase in violence with the drinking. So homicides, suicides, domestic violence. There's an increase in crimes. There are injuries like falls, drowning, fires, unintentional firearm injuries. So, and then all the way to acute intoxication, right? I mean, alcohol is a poison, and it can be fatal just from drinking too much. So there's all those levels, not to mention relationship effects as well, work productivity effects. So a lot of immediate effects from the drinking, and then the long-term effects, there's a lot of those as well. There's chronic illness, high blood pressure, diabetes, the obesity, and then things that I think most people wouldn't think of as necessarily being related to alcohol, but cancers. It increases the risk of a lot of different types of cancer. It's also depression. It's a direct toxin to the liver. It causes nerve and brain damage. So over the long haul, it can have a lot of health effects, and I don't know that they're always recognized other than in studies, but they can be somewhat covert. I mean, people don't necessarily see the alcohol relation, but really myriad health effects.
John,
I was just going to say I can add a couple of numbers to what Dr. Hartlaub was talking about. So nearly 50% of drownings are alcohol related. Nearly 40% of residential fire fatalities are alcohol related. 30% of suicides, 65% of fatal falls, and nearly 40% of ATV deaths are alcohol related. And Doctor, you were talking about sort of unseen, and the way that we talk about it is that people don't connect the dots, right? It becomes kind of a footnote, right? It's the alcohol may have been a contributing factor when these things happen, and without the presence of alcohol, they may not have happened at all. So, you talked about domestic violence and episodes while somebody is drinking more than they should, go way up. You say things and do things that you ordinarily wouldn't say and do. You're out at the bar and somebody looks at your wife or your girlfriend in a way that you don't feel is right, and pretty soon you're into an altercation, and then it gets worse and there's a weapon or a shooting or a knife, and so it gets reported as a barroom brawl or a shooting, and minus the alcohol, many of these things just don't happen. So that again is part of it's just part of the underlying culture, and that it's not the story as much as it should be.
John,
And if
go
I could just,
ahead, Sherry.
if I can just pile on,
Yeah.
forgive me, Tim. once it progressed, and let me just lay all my cards out there. I'm part of Maureen's 1/3 that doesn't drink, but I got there the hard way. I mean, I got there by way of alcoholism. And the other challenges socially, the other costs are unemployability. I mean, alcoholism is one of those things that medicine cannot make go away. We can treat it, we can get people dry for a time, but that susceptibility to relapse will be there their whole life. So for a lot of people, it makes them unemployable. And going into Wisconsin's sort of economic next period, whatever that is, where workforce is going to be a chronic issue for all of us, unemployability is a huge issue.
I would say too that, so to be clear, we're not necessarily talking about everybody in this category as an alcoholic. So as Dr. Hartlaub said, with the screening and brief information and intervention and referral, lots of people are just kind of in that you drink in an at-risk way, which is, on occasion there's a binge, or that on occasion you're more than 14 drinks in a week. So not everybody is in that diagnosable category, but when you've had too much to drink, and again, not thinking the way that you normally would, and bad things end up happening, all those accidents and injuries, and so it is clearly for people in that problem category, alcoholism, right, that many of these things are steady and constant and ongoing. But there's also a large group of us that drink in a way that creates this additional risk at times that leads to other bad things happening.
And Maureen, as we look statewide, are the impacts of alcohol misuse and excessive drinking, is it pretty kind of spread out statewide? Is it impacting certain populations more than others? How does that look at a kind of a statewide level?
Yeah, that's a great question. We really saw in the data, when we look at it, Black Wisconsinites have lower rates of drinking, but their health impact is more. So they're more likely to die or have permanent disability, from the drinking that they do. So that, is definitely a vulnerable population in terms of alcohol use. And of course, we have stores that sell Alco Pops. So it's literally a binge drink in a can for about $2.50. So that's, a huge concern in terms of the access and availability and the cheap price of it. First of all, I agree with what everybody said, and the data definitely bears all of that out. In terms of that driver of a lot of harm and cost, certainly those who have an alcohol use disorder bear a tremendous burden. Their employers do as well. But the binge drinking population is also probably the largest driver of cost. We estimated in the 2019 binge drinking report that was done by the Population Health Institute at UW that it's 75% of the cost is driven by binge drinking. So again, these are folks, like 89% of them are not diagnosed with an alcohol use disorder. So this, to me, this is a place where we have a lot of opportunity to bring our culture and our, regulations and our policies in line to support kind of a healthier level of consumption instead of this excessive consumption of alcohol. And the State Council on Alcohol and Other Drug Abuse released a report on excessive alcohol use, and it has 61 recommendations for our state. And if we enacted all of those, most people who go and have a couple of drinks with friends would never even notice, right? But it would definitely have an impact on that binge drinking and that excessive alcohol use. So there's things that we can do. Certainly there's a lot of work in treatment and intervention, and we support that 100%. but there's a lot that we can do in our communities to help change this. And the biggest payer, frankly, of all of this is the employers. They lose productive employees, people calling in sick, not able to perform. So there's a huge cost to our employers. And I think, the next is our government in terms of, what Jerry was talking about. It's estimated that a fatal OWI costs $1.75 million. So that's, and a lot of that cost is wrapped up with insurance and that kind of thing, but there's a lot of local government costs, there's court costs, there's a lot there, investigation and all of those kinds of costs that we all bear. So if we can kind of bring this kind of back to a more normal level, we have healthier communities, healthier people, and I would argue, happier folks as well.
So Maureen, why are the excessive drinking rates so high here in Wisconsin? Is it our culture? Is it availability of alcohol, all the above? I mean, what are some of the driving factors for these high rates here in Wisconsin?
Yeah, that's a great question. Well, in Wisconsin, we've decided that you can sell alcohol with almost any business. I had a bakery down the street that sold beer. And that's a problem. In other states, they don't sell alcohol with gas stations, right? And that sends a direct message, I think, in terms of kind of our willingness to do that. Now the cat's out of the bag on, a lot of that, but our Class A, so our off-premise, has really grown in terms of how many places sell alcohol. Now you can't walk into Target or Walmart or, without having, a lot of alcohol. The Walgreens down my street, knocked out basically the toy aisle to put alcohol in.
It's not funny.
No, it's not. So there's that piece. We also have a high prevalence of, bars and restaurants that serve alcohol. And again, in a lot of other places, not every restaurant sells alcohol. And there's this feeling that it's for economic development. When I talk to local officials, they feel that it helps, their local economy. What they're not looking is at the other side of the register in terms of how much it's costing the community, not only in healthcare costs, but, local government and law enforcement. So I regularly talk to chief of police and sheriffs and patrol officers. And one sheriff was joking and he said, if we didn't have alcohol, we wouldn't really have much business. I've heard estimates anywhere between 50 and 80% of calls have alcohol involved with them.
Go ahead.
So I don't think we've recognized the economic toll that this has on us. And there are, again, things we can do, very reasonable kinds of changes that can really make a difference and kind of bring our culture, back to a more normal level of that. So I think it's a bit of, there's a lot of access, there's a lot of low cost alcohol available. And then we've been permissive, both on the local and state level, in terms of opening up opportunity for more access. I didn't realize there were parades that had barrels of beer that they would throw red cups to the audience and have people run up and pour alcohol into those cups. Parades have generally been like a kid-focused event, right? And it seems like we've also mixed up a lot of our festivals with becoming kind of highly intoxicated areas. And that's also a concern that many communities are taking action on.
Sherry, I want to ask you about the local side of this. I mean, Wisconsin has one of the most locally focused alcohol control systems in the country. As John pointed out, a number of Wisconsin cities are in that top 10 list for most bars per capita in the country. I mean, I've seen that stat as well, 7 out of 10. So most of the cities in that top 10 are from Wisconsin. What impact does this local control have on implementing alcohol restrictions or curbing some of the alcohol drinking? Does it, as kind of Maureen made the claim, the statement, does it potentially make it tougher for a town or city to see the long-term public health impact of more drinking when they are initially faced with this maybe shorter term incentive of more revenue?
The
big question.
If I were to assemble a room full of mayors right now and say, what's your number one alcohol problem? A majority of them would tell you a lack of licenses to spur economic development and downtown redevelopment. I'm not defending or condemning that statement. That's reality. And Maureen and I have talked about this. It's part of Wisconsin's cultural mindset that drinking equals equals socialization. I'm in my spare time, I volunteer on a local alcohol abuse subcommittee. I live in a suburb outside of Madison, and it is shocking to me the percentage of establishments that sell to underage purchasers. And I'm not talking about, the dumpy old corner bar around the corner. I'm talking about some major Wisconsin, major national retailers that seem to sell almost willy-nilly to underage buyers. Most of my members would take issue with, the statement that they have a lot of control about alcohol licensing. They feel like the law is so convoluted that it's virtually impossible for them to deal with it. We're struggling with that in my community now, but frankly, there are some things we can do and will do. I think there needs to be an evolution in how people use alcohol as part of socialization. We learned almost 100 years ago that just prohibiting it entirely is not going to happen. But I think we need to shift away from, where I grew up in northern Wisconsin, where 2 drinks a day is normal. That's not heavy drinking. No one would have thought of it as heavy drinking. But that calls for an entire social mindset shift. And I think that's the sort of thing you got to nibble at a bite at a time. I think we can go after underage drinking. I think that's a good thing for us to start to pursue. I think we need to raise consciousness about these costs because the public doesn't get it. Beer tax is still a nickel a gallon. That's what it was when it was 1935. And yet you have police departments where, depending on who's counting, at least half of their costs are alcohol related. I think that's another place we need to look at.
So you're all immersed in this work, and so you may argue at this point, but the significant health impacts of alcohol doesn't really garner the same attention as some of the other significant health issues in our state. I mean, drug overdoses and health access and mental health. There's obviously overlap amongst those, and and they are really important issues, and they probably deserve even more attention. They do deserve more attention than they get, but they also receive more attention than the health impact of alcohol. John, why do you think that is? Is it all this cultural part of things, or why do you think that is?
Yeah, I think it is part cultural. Maureen and Jerry, you guys can correct me if I'm wrong, just to sort of pile on again. But as a parent, you can take your child not only into a bar, but you can have that child served a drink, right? And there's nothing wrong with that. And I think if you're not from Wisconsin, that feels like a crime in some ways, right? So again, it's a part of that culture. And as Jerry's saying too, if the mayors are feeling like we just don't have enough license, and so when people like us show up, and I mentioned to you before, Tim, we ran this campaign. I don't know if it gets turned around. In any case,
now it's upside down. You got it first time.
Stop drinking so much, Wisconsin, right? It's risky drinking, and we paired it with the SBIR screening, and we went throughout the community to try and get support. And we took it to local business leaders and associations and to government officials, and we couldn't get anybody to really rally around it. And it felt like there just wasn't enough political will to take that on. And some folks didn't even really necessarily agree to it because of the revenue that it generates. And even when we could get them to acknowledge the negative consequences and the other cost, it felt like it was sort of being dismissed as that's just the cost of doing business. And so, I mean, felt like that's what we're really up against. And as Jerry said, I think most people could get behind underage drinking, but I've even heard this sentiment. I think we all have, that we did it when we were kids, right? It's a rite of passage, and you're not going to keep them from drinking. And so, why even go through the extra effort? And I remember a statistic somewhere that if you've prevented somebody from drinking excessively, 21 or 24, you can tell I'm really talking off the top of my head, that the likelihood that they're going to have an excessive drinking problem or become alcoholic is greatly reduced. And so we know that, right? But it's hard to get people to join our cause.
Dr. Hartlaub, what do you think? Why? I mean, you listed at the beginning all the, indirect, direct, short-term, long-term impacts of excessive drinking. Why isn't this, kind of gaining more attention or awareness in our state?
Well, I hope that with screening programs that it will, but I do think some of the things that have been said in terms of people just not, it's sort of being the culture that it's okay and that it's not a problem, and it isn't as directly tied to the illnesses as some other things may be. So it's not as recognized. I know in primary care. I mean, I have been surprised, and I think many clinicians have been surprised sometimes when they ask about the level of drinking and find out that it is high, and it's surprising almost. Like you ask the question, but not really expecting that answer necessarily. So it's really kind of hidden, but we definitely are finding it with the screening. And I think that is doing a lot of good. It's a little hard to quantitate exactly the benefit, but the sense is that it really is helping a great deal.
So amidst these headwinds and entrenched cultural barriers, we've talked a little bit about this already, but what more can be done to address this? Maureen, you, as you mentioned, you're the chair of the Alcohol Prevention Committee of the State Council on Alcohol and Other Drug Abuse. You had a report that came out late last year with a whole slew of policy recommendations to help decrease excessive drinking in Wisconsin. Can you highlight, some of the most kind of significant recommendations that came out of that report?
Yeah, very pleased with that report, and just thrilled the number of communities that are doing work to make that become a reality. So seeing like healthcare take on doing the screenings and those brief interventions. So again, for binge drinking, that can be very effective. The challenge is, of course, and this we had in tobacco too, right? You'd coach a patient, you'd work with them, and then you'd send them back out into a world where secondhand smoke was everywhere and people were smoking in workplaces, including bars and restaurants. So you need to kind of do both, right? You need to change the community environment and also support them, with the healthcare system. So those recommendations, we have that for health systems as well as court systems and schools. It can be a very effective process with kids because we know, and this is part of what I think is startling, if kids binge drink, they are much more likely to become addicted to other things, including opioids. So there's a lot of attention on opioids and overdose deaths, but it doesn't start there. It generally starts with alcohol. Tobacco to marijuana as well, but it's all that same part of the brain. And that's where I think there's a lot of denial about how much the opioid use is connected to binge drinking, especially in the youth. But there's, good evidence for that. So if we can focus on working on underage, that's great. But again, it's not quite enough because you can't throw minnows in a dirty pond and expect a different result, right? And so again, we see a lot of communities kind of rolling back those festivals where there's drinking everywhere, where they have fencing and wristbands, and they make sure volunteers are trained, you know, to make sure there's not over serving going on. And those kinds of things are very effective. And again, set a community norm. One of our top recommendations is alcohol age compliance checks. We've seen results because a lot was suspended during COVID, where some communities have a 75% sell rate to underage people. Now, generally speaking, that doesn't keep happening, you know, that retailers are very responsive to that, and they start changing those practices, making sure their employees are, you know, aware of it. But the disappointing stories are the ones where the letter telling them that there will be alcohol age compliance checks is on the bar and they still sell to kids, right? So there's definitely some enforcement and things that need to happen that way. Funding for alcohol age compliance checks statewide would be a great step in that direction. So those are very effective. We're also doing a couple of things. One of them is place of last drink. So this is something that law enforcement can help out with in terms of being able to say, yes, alcohol was involved. So not only the OWIs, but other arrests as well. And then what you can do is look for a pattern. Is there a convenience store that's selling a lot that people are citing? Is it a bar or restaurant? In Minnesota, that's about, you know, the bars and restaurants are about 30%. And people are like, only 30? I mean, that's good that a lot of our, you know, 80+% of our bars and restaurants are never on those place of last drink reports. So most of the industry is doing a good job. We need to make sure that all of the industry is doing a good job in that way. So going beyond that, what are the places where people are being overserved? Well, in homes, you know, at their cousin's house, you know, those kinds of places. But we also see parks and festivals as a big number. Again, those are things that the community can come together on and make changes. You know, maybe not every park should have alcohol, right? That might be easier for police to enforce. So, you know, those kinds of things are very effective policies. But it takes everybody working together. It's law enforcement, it's healthcare, it's community coalitions, you know, getting on the same page. Tim, you said earlier about how this flies under the radar. It doesn't with community health assessments. It's definitely in the top 3. And in many cases I've been contacted, it's the #1 issue. So there are a lot of members in the community who do understand that this is an issue. And the challenge is, you know, we're not out to stop restaurants or bars from serving, right? It's the over-serving that we don't want to see in our communities. It's changing some of those practices so it's not easy to steal those single cans of alcohol pops. It's, you know, not putting them right next to the soda. You know, having space in between those kinds of things that can be very effective, and not having advertising at toddler level. It's amazing how many signs and displays are below 3 feet. So those again are kind of reasonable kinds of things that can be done to change. And we're seeing a lot of interest and work in that area. So I'm optimistic. You know, this is Wisconsin after all. We can do these things right. We've done them before, we can do them again. So I remain optimistic that people want to make good, healthy changes. And it's not that you won't have a beer watching the Packer game. We're not talking about that, right? But you don't need 9.
I can remember when the tax on tobacco started going up, and almost proportionately the use started going down. And Jerry, you had mentioned earlier that the beer taxes remain the same for I didn't do the math, 65 years or something like that, right? So Maureen, is that a part of, a possibility? Is that being considered at all, that if it's just not quite so affordable, then it can't help but bring some use down a little bit? And that's
Right,
that's like blasphemy in Wisconsin, right? To say that a can of beer should cost more.
right. Well, and a lot of beer does cost more when you look at craft beers, right? And, those can be pretty expensive. So it's possible. States around the country have done this. Alaska's had a very successful campaign on that because they've had a big problem in Alaska as well. So that is definitely one of the recommendations, to look at raising the price. The beer tax was last raised in 1969. And there have been other small increases in wine and spirits. But really, we need to look at it. It doesn't matter what form it comes in. It has the same impact on your body. It's, the ethanol. So really, we should be taxing these things, potentially looking at different rates. There's a point where you reduce youth consumption, which is what you're talking about with tobacco, which was very effective. It also helped a lot of people who wanted to quit in tobacco. So it decreased usage, but it increased revenue for the state. So right now we get about $81 million from our current alcohol taxes. So please put that up against the binge drinking report that shows we spend $4 billion a year. So there's a big mismatch, and that's up to communities and legislators to take a look at that and dive deeper into that.
And John, that's a good question. You stole my follow-up, and I appreciate it. It's a good question. And Maureen, I wanted to ask, about that a little more. I mean, what has been the response from policymakers at this point? I mean, in your report, you mentioned that raising the tax on alcohol would be, quote, the most effective regulatory policy to reduce excessive drinking and related harms. I mean, I don't, and I could have missed it, but I don't see any state legislators kind of taking that up right now as a top issue. I mean, what's been the response to that, amongst policymakers so far? Is there movement in that direction at all?
The silence is stunning. So I don't see, a big push towards that at this point. Frankly, we're really encouraging our coalitions around the state and folks who talk to us about these issues to do the things that they can do kind of in their local community and within their power. So, I think it should also start with civic organizations. If you're raising money, especially for violence prevention or domestic violence, we'd encourage you not to do it at a brewery. If you, feel an absolute necessity to have a drink ticket, please make it one. Follow the guidelines in terms of what would be most healthy and helpful overall for the community on these issues. So I think there's a lot of work, that can be done locally, and, even with, like I say, organizations, and really taking a different approach. And, the people will have more money to give if they're not spending it on alcohol, right? So there's a way of, making this all work for everyone.
Jerry, where do you see the most movement in local? Yeah, please go ahead.
Tim, I would say this is a case where it has to start at a grassroots level. I think individual communities, taking a look at your rate of underage drinking, your rate of binging, all of those things. Maureen and I actually worked on a legislative proposal for my organization about 6-7 years ago. And I frankly got myself slapped silly by my board of directors. There is almost zero.
What was the proposal?
To raise the beer tax and use it to fund police. Because what's funny is there is a consensus around Wisconsin right now that we have a crisis in policing. There are fewer officers on the street now than there have been in 20 years. Well, if half of your police time is dedicated to policing alcohol and alcohol-related issues, there seems to be a very simple nexus there. But too many locally elected officials, too many of us, let's just say too many of us, still see alcohol as part and parcel of our economic development, of our social scene. We need to start chipping away at that narrative before the legislature will go anywhere near it, to be very blunt about it.
And Jerry, where do you see it? From at the local level, where do you see kind of the biggest possibility to chip away at this issue? I mean, you mentioned doing more to crack down on underage drinking. I mean, where do you see kind of the best opportunity at this point at the local level?
Well, and I keep going after underage because that's what we're working on right now in my community. That's what the mayor and the new police chief and the police committee sees as the low-hanging fruit. Because after all, who is in favor of a bar or a store breaking the law and selling to a teenager? That's something that's easy to build a narrative around. I frankly was cheered when Deanna talked about in her preliminary remarks, their initiative to drive rapid change in this. There needs to be Maureen and a number of other people out there talking about this on a global scale, but then very quietly at the local level, we all need to be updating our local alcohol abuse ordinances, getting our police departments on board. You will find, I think, surprisingly, a fair number of police departments that look the other way. Maybe that's an unfair statement, but more than you want to know, really don't want to go after this issue, even though they're the ones that have to clean up the mess.
Dr. Hartlaub, what role can health systems play in all of this? What more can health systems do? If you've taken a leading role with your screening model, what else can be done?
I think that screening is one of the most important things we can do because of the prevalence. I mean, it's so out there and we don't know unless we ask the questions. And if we determine that it's an unhealthy use, we can tell them what the speed limit is. So it's like people are driving on a road, they don't know what the speed limit is, and they're following all the rest of the traffic and going faster than they should. If they see a speed limit sign, they can think, oh yeah, okay, so now I know what the speed limit is, I can watch that. And so I think that's analogous to what we do with patients. They just didn't know what the speed limit was. The evidence is that if you screen with adults, which we try to do at least once a year with all of our adults, and you identify an unhealthy level of alcohol use and give them a brief intervention, which might be a couple of minutes, it reduces the rate of drinking at that unhealthy level by about 40%. So it's like they didn't know what the speed limit was. So I really think if we can do that pretty consistently, we can make a huge difference there.
Great. John, what do you think? What more can be done to increase awareness?
I mean, I think that's a huge part of it. And it was that campaign that we had along with the screening. And it was simply saying out loud, I'll give people a tour of our agency and we'll come past this section where we do this alcohol stuff. And there'll be a group there. And I say, if you're a man, right, it's 4 or 5 in one sitting. It's more than 2 a day or 14 in a week. And I can see them doing the calculation in their head, right? Is that me? And so it's exactly as Dr. Hartlaub says. And then I say, and if you're a woman, it's half that. Right. And then there's a big hard swallow. And I think it's just that awareness of, and I get that question sometimes too. Are you saying I'm an alcoholic? No. We're saying that when you drink at this level, even on occasion, creates risk for you. And so I think that's a perfect way to describe it, is to say, what's the speed limit? And when people know that, and with even a little bit of information, they will cut back on their alcohol use. So that's I think that's a really effective way to start to get at some of that. I'm not an expert at that community level stuff and how are you going to get people to I don't want to get slapped silly. I don't think any of us do, right? So, or lose my job because I'm pushing too hard on something that most people don't agree with.
Great. So we are quickly running out of time here, but I want to kind of help sum things up. Want each panelist to take on a concluding question, and that is, what do you think is the most significant step that can be taken now to address the health impacts of excessive drinking? So I know we talked about a lot. I know there's a lot that can be done, but if you could kind of just single out one, one kind of immediate kind of step that could be taken now to help address this, what would it be? And Maureen, let's start with you.
Great, thanks. Well, first of all, thank you for hosting this panel. This is part of it, right? Being able to talk about this so that people understand what's happening in our state. So obviously awareness about the problem is, where you have to start, but for me, that's the very, very beginning. Then you need to look at what you can change. And the Sciota report on excessive alcohol use provides many, many answers from many different positions. Again, civic organizations, local government, state government, even the alcohol industry. So I'd encourage folks to take a look at that and figure out where their time and energy would be best spent.
Excellent. Dr. Hartlaub, what do you think? What is a step that can be taken right now to address this?
I think, and from a healthcare perspective, it is finding people who are at an unhealthy level, letting them know that they are, letting them know what the speed limit is, and why, what the risks are, because I think awareness is very powerful.
Great. John, what do you think?
I was going to say, speak up, right? So it's been mentioned, we all know somebody that probably is drinking too much, or we've been affected or impacted. And to be able to say, look, I recently became aware of this information. I think you might be drinking in a way that's causing you some problems or issues, and there's some help out there. Start by talking to your physician, by going through your employee assistance program. We will always say, dial those 3 numbers, 211, anywhere in the state. Somebody can connect you to resources. The stuff is, it's anonymous, it's confidential, and just let people know that there's a way to reach out and get help.
Great. And Jerry, we'll give you the last word.
Well, first of all, I want to put an amen in there for health screening. I agree. I think that's very helpful. But for my neck of the world, democracy still works. Talk to your mayor. Tell your mayor that this is an issue that matters to you, because a lot of them, democracy is based on what is it the local community wants. And if they don't know you care about this issue, they're not going to do anything about it. So I would say talk to your local elected leaders.
Excellent. Well, thank you all. Thank you all for doing this today. This has been a great, informative discussion. I think, as always, we could have kept it going even longer, but we appreciate you doing this. Appreciate you all for tuning in. Thank you to our sponsors for making this happen, and hope to see you all next time.
Thanks for